Reviewing the preparations. Is everything ready? You're now at week 38. The baby can arrive any moment. It's time to look over and see if everything is really ready. The first thing you want to check is every piece of fabric that's going to touch your baby washed and dried with a correct baby cleaner and ideally a fabric softener that's specifically for babies. Their skin's going to be very sensitive, and even with this you're going to see little red dots popping up and whatnot as the baby gets used to being outside of the womb. Don't panic, just do what you can to make sure that everything's washed ahead of time. Is the bedroom ready? By this I mean, is the bed big enough for the baby to sleep in with you? Do you have the little sleeper that's going to go in between you on the bed? Do you have the smaller crib that's going to be off to the side for putting the baby to sleep in there and other times when she's not with you on the bed? And have you put the cleaning supplies in the bedroom so that you're ready to change diapers on the spot? Do you have your pediatrician? If not, now is definitely a good time to ensure that you have your pediatrician finalized, that you're happy with them, and also that you've discussed with them the possibility of the baby needing food, not necessarily breast milk, for the first few days while mom's milk production gets rolling. So take that up with him, get the alternate food ready, and have it in the kitchen ready to go. Next, do you have the emergency contact numbers for your gynecologist, your pediatrician, and the hospital? As you get closer to the due date, it's going to be very important that you have these, because if your wife goes into labor, you're going to need to let them know right away to be able to go to the hospital. When you're ready to go to the hospital, what do you need to take with you? Okay, first off, you've all heard stories of mom packing the entire house into several suitcases to go to the hospital. That's not necessary. First, what you want to do is check with the hospital. They're going to have a list of requirements of what you need to bring as a minimum for the baby. This generally involves some body suits, the burping rags, the puke rags, the things to wrap the child in some blankets, some socks, some mittens, and some other simple stuff like that. All that fits into like a package about this big, so don't worry about it. It's not a lot. Next is what's mom going to be bringing with her. She's going to want a big, comfortable bathrobe that can cover over the hospital gown. You know, like big, fluffy cotton types. Some slippers. She's going to want a couple changes of clothes, maybe just one. She's going to need a few spare changes of underwear, and she's going to need a lot of maxi pads. As soon as the baby's born, there's going to be a lot of bleeding, and she's going to need to change the maxi pads. An oversized pair of underwear is good, because if she's going to have a cesarean, they're going to pack it with bandages around there, and it's going to have to be able to fit over that. Now, probably you're going to be staying with her too, which means if it's not nearby, that you're going to want to bring at least one change of clothes, maybe two. Usually they have a shower in the room that you can use. So don't make a big deal about it. If you live nearby, you don't have to worry about it, but otherwise, bring a change of clothes. The other thing is, don't forget the camera. You're going to want to bring your still camera and your video camera, and if you're going to be staying there for a few days and the room is big enough, bring your computer too, so you can download them right away and you and mom can look at them and enjoy them and also share them with any immediate family that you have there. The last point of preparations that I'm going to bring up is something that you should get ready at least a month ahead of time, and that is you need to figure out something special for mom. Let's face it, they've just done something more physically difficult than you will probably ever have to do in your entire life. So you really need to acknowledge them for that and tell them how much you appreciate what they've done. Flowers and jewelry, my friend. You don't have to spend a lot, but you do need to make it something special. You're going to want to give it to her on the night of the birth after the baby's been delivered and you're alone in the delivery room or the hospital room with each other. So just think about it, plan it out, make it a special moment. In terms of being ready for the baby to arrive, there is a thing called labor. I'm going to let your gynecologist or your doctor go over that with you because I am not a medical doctor. They're going to tell you exactly what it means and when you need to be ready to go to the hospital. Make sure you discuss it with them and have them explain it thoroughly to you and mom so you know when to go and you don't panic. This is a precise science now. They can tell you the exact timing of the contractions and what the hell a contraction is so that you know when to go and you're not having several false alarms on the way to the hospital. Next, how are you getting to the hospital? Motorcycles won't work, bicycles won't work. You're going to need an SUV or a large car for mom to comfortably be in there with a really big belly to make it to the hospital when she needs to go to the hospital. If you're having a cesarean, it's really predictable because it's going to be on week 38 on an exact day that your gynecologist is going to give you. If it's a natural birth, it can be any time after or around week 38. You're also going to want to think about the route you're going to take to get to the hospital. You may not want to take highways or anything that might be heavily congested. A long, traffic, aggravating drive to the hospital is definitely not something you want on the way there. If you can avoid it, try to. Next, let's talk about preparing for the actual birth itself. This can vary slightly depending on whether you're going to have a natural birth or you're going to have a cesarean. But the basic preparations are still the same. You're going to be entering in the hospital. You're going to be signing some forms, some release forms. You may be paying at this point up front to pay for the hospital if your insurance isn't covering it. The next thing they're going to do is they're going to be getting mom ready for the operation. Now, I can't tell you really what's going to happen with the natural birth because we did a cesarean. You're going to need to talk to a friend who's had that and to guide you through that. For a cesarean, we're going to take you and mom into a room to get mom ready to have the baby. In this room, what they're going to do is they're going to give her a local anesthetic. They're going to let her sit there for a bit until that takes effect, and it's generally 30 minutes to an hour, depending on the anesthesiologist and what he gives mom. You're just going to wait with her, comfort her, be there with her. She's going to be freaking out a little bit, and you're probably going to be freaking out a little bit. So try and stay calm and keep each other happy and smiling. As soon as they're going to get ready to take mom into the delivery room, you're going to need to change real fast from your clothes that you're wearing into hospital garb, the blue surgical outfits or whatever the color may be. They're going to have you stripped down to your undies and your shoes, and they're going to put you in this. Here for getting in, I recommend you just take a still camera that can also take video, a nice small one that you can hold with one hand, because she's going to be holding your hand pretty tightly with the other. And really, stills are a bit more elegant than videoing the entire thing at this point. And as a comment here, go into the operating room. I know this is more common, but I also know there are dads that like to wait outside. That is very passé. She needs you in there with her. This is an intense moment, and she needs someone holding her hand that she loves and trusts, and that's you. So get in there. Now, as soon as you arrive to the operating room, they're going to get ready and start putting up stuff to get ready for the delivery. They're going to put up a little sheet so you don't have to be involved in all the drama that's happening down there unless you really want to be. But really, you should be focusing on mom at that point and helping keep her calm, holding her hand with one of your hands and the camera in the other. Now, look into her eyes and keep telling her how beautiful she is and how amazing she is for what's been done. Once the birth starts, try and just stay calm, stay there with her. She's going to be breathing. Just keep quiet. Be there for her while this happens. At a certain point during a cesarean, one of the doctors in the room is going to come over and they're going to give your wife's belly a big push. This is an intense moment. Just keep her breathing. Keep her calm. Look into her eyes. Just, she needs to breathe. It's really important. It's going to make it easier for the baby. Right after this, what you're going to hear is you're going to hear your baby crying. They're going to cut the umbilical cord and they're going to take your baby over to a weighing and measuring station to clean him or her off and to get them ready to give to mom. This is a good time to start taking photos of the baby. You can always make them black and white later so it's not so graphic, but go in there, get it, use your still camera to grab a few seconds of the baby being cleaned off. They're going to be pretty cool at this point. They've just made it through a pretty intense procedure, but they're going to be pretty cool. Next, what's going to happen, or what you should insist happens, is that the baby gets put in mom's arms. It's just going to be for a few moments because they do need to bring the baby up to the maternity ward, but give mom that moment. Take some photos of it and really let her enjoy what she's accomplished because, man, like I've said, it's not something you're ever going to have to do. So really respect that, give it to her, get some photo and video if you can, and then be ready to leave with the baby.